Hello and welcome. Thanks for joining me. This is a special as I have just received today. I received today the result of the grievance I had with UVA patient relations since the department itself was not able to address my concerns. And I'll go over it in detail, but basically they are not they're not listening to me. They're not addressing my concerns. They're taking the lies of the doctor as fact and covering their own ass. And because I don't have a recording of that initial pre-op, I can't prove them wrong. But they lie repeatedly in the letter. And I'll link to it below just so you can read it. But I don't know what else I can do at this point. Still haven't been able to find another doctor that could potentially help me for malpractice, or another lawyer for that fact. And it's been hard not to think about suicide all day, like every 10 seconds. Don't know why I'm alive anymore. I really don't. So this is dated October 3rd. I only got it today via email because the mail is really slow, I guess. Dear Valentine Ports, thank you for contacting the Patient Relations Department to share your concerns related to your experience at the medical center. At your request, the formal grievance was opened on September 5th, 2023. Members of your care team, along with an interdisciplinary review team, thoroughly reviewed your concerns, and I have the following information to share. You expressed several concerns about your post-procedure recovery related to clitoroplasty, labiaplasty, and vaginoplasty procedure you had on May 31st, 2023. Now, they always said clitoroplasty, that was always in the documents, but they never did anything about my clitoris, so I don't know why they included that. It was just so they could charge more? I don't know. We apologize for the difficulties you have faced during your helical journey. Well, that's putting it very mildly. We appreciate the opportunity to provide you with the following information. Regarding if Dr. Stranix was confident before and during the surgery in his ability to provide the outcomes that were discussed with you, Dr. Stranix executed the procedure to the best of his ability in the exact manner he discussed with you preoperatively in the standard fashion for these types of rescissions. He didn't really discuss that in detail. He just didn't. He extends a sincere apology that his best efforts were not able to achieve your desired outcome. You know, this is just glossing over the fact that he didn't really talk to me about all the details. And if he had, it would have made all the difference. Regarding your concern if this was a standard case and if the protocols were followed, Dr. Stranix utilized the standard approach to labial revisions with the labia minora pleating. No vertical incisions were made on the labia. They were only undermined in a superficial plane from the posterior scar release incision, and then the skin pleated together with a vertical fold to achieve projection and recreate a labia minora where they were absent. You were informed that moderate overcorrection of the labia minora is due to the anticipated loss of projection that occurs. That is also a lie. I was not informed of that. So again, just covering their ass. Due to the anticipated loss of labial projection, Dr. Stranix also performed a fat grafting procedure to add labia majora volume. This is a common procedure that is performed because the labia majora tends to lose volume after the initial vaginoplasty. This was the main thing I was going in there for. Only 50 to 70% of the grafted fat volume remains permanent. It can take 6 to 12 months before the final labia majora volume retention and labial projection are determined. We apologize that you were dissatisfied with the location the fat was grafted from for the procedure. The fat grafting was performed with the goal of achieving labial fullness, as when not performed with the intent of body contouring. Why that wasn't the case just seems like being unprofessional and being mean, just straight up mean. Because they took it from a spot that is totally inappropriate. And I never really had a chance to change. I agreed to it right before the surgery, but I didn't really feel like I had a choice at that point. Like I was cornered into it. So, again, another reason why I feel like killing myself. I know, like, this body is just wrecked at this point. The central abdomen was recommended as the optimal fat grafting site, as it allowed the grafting procedure to be performed entirely through a single stab incision and minimized scarring. I don't see what the advantage of that for me is. Honestly, sounds like it's an advantage to the doctor, but not for me. As part of the surgery, Dr. Stranix also performed a posterior introitus scar band vertical release and horizontal closure to widen the aperture for improved patency, whatever that means. Again, not using normal language, so I can't understand what they're talking about. This is a common revision procedure. Dr. Stranix advised you prior to the procedure that the opening of the posterior introitus with a vertical scar midline release would improve the access to your introitus and potentially reduce the likelihood that your partners would confuse the urethra for your vagina introitus. He said that. Not true. It hasn't had that effect. No tissue was removed or discarded from the labia, vaginal canal. I never said it was. They keep saying that this was something I'm concerned about. No, I never said it was discarded, but it's gone because it was so damaged by his work that it died and was reabsorbed by the body. So it's like he doesn't understand what the problem is. He still doesn't. Regarding what can be done to rectify the nerve damage and function to your genitalia and your concern that you were not made aware of the possibility that you could lose all sensitivity to your genitalia. The only incisions were made during the procedure to the superficial skin, temporary changes in sensation. Yeah, it's not about the incisions. See, it's like, it's not, the incisions weren't the problem. Temporary changes in sensation are possible following superficial skin revisions, and you were counseled on the possibility prior to the outcome of the procedure. That's also a lie. I specifically asked if there was a possibility of nerve problems, and he said no. So, complete loss of all sensitivity, however, is not a common outcome for this procedure. It can take the time for the nerves to recover if they are disturbed by the procedure. Temporary changes in sensation may take 6 to 10 months before returning to baseline. After you discussed your concerns with Dr. Stranix, he placed an expedited referral to pain management and coordinated with your primary care physician, Dr. Catherine Casey, to prescribe multimodal pain therapy under the pain management appointment. Dr. Sean Corbett also evaluated for possible surgical revision, and his recommendation was to wait at least 6 months post-operatively until your pain is controlled before pursuing any additional intervention. Too bad he didn't tell me that. You expressed concern that Dr. Stranix dismissed your concerns as nerve damage. Dr. Stranix apologized that he felt he dismissed your concerns as this was not his intent. He tried reassuring you that sensory changes are a normal part of recovery and discussed the possibility during your preoperative appointment. Also, a lie. Straight up lie. All incisions were isolated to the superficial skin only, and deeper structures were not involved. The superficial skin is the most sensitive part. The most sensitive part. Permanent damage to major sensory nerves is not anticipated. The sensory changes you're reporting are typically temporary but may take 6 to 12 months to return to baseline. You know, the skin's not there anymore. I know nerves recover, but if the skin isn't there anymore, I think it's this, they're all going to maybe agglomerate together if they come back at all. I honestly, I don't see a reason why I should wait to find out. Regarding documentation in your medical record, on September 12th, 2023, you contacted me regarding requesting to dispute the documentation on your medical record. You were provided with the request for amendment health information to file an amendment request to health information management, which I did. The request for an amendment process can take up to 30 days to be completed. Please follow up with health information management, etc. Regarding reassurance this will not happen again, your feedback is important to us. We will certainly be even more thorough in our preoperative counseling of patients regarding specific surgery techniques, potential sensory changes, and how the healing process evolves over time. We are truly sorry that you have concerns about your care. We appreciate the opportunity to reflect on the care provided. Your feedback is integral to our quality improvements, efforts, and professional development. The review is complete as of today, October 3rd, 2023. Please feel free to call me if you have any questions or concerns. Sincerely, Ashley N. Jackson, Patient Relations Representative. So many lies. I'm sure they don't want to tell the truth, because if they told the truth, then it would be easy to win a victory against them in court. But I would think they would be caring enough and have enough compassion and enough desire for justice and doing the right thing. I mean, especially with a hospital, you know, they're there to help people. They're there to do the right thing. And to not be honest about such an important topic just blows me away. I suppose I should expect it because, you know, people are often terrible, but I was hoping for better. I really was. So, there's nothing I can do next. I've gone through my options. I have nothing to live for. I have nothing in life I enjoy doing. So, with that, I guess all I can say is I hope you have an experience with your medical professionals where they're not complete scumbags and lying bastards and completely interested in covering their own ass as opposed to being honest. I love you. Aloha.